Welcome everyone to another Prime Facial Plastics webinar. Last month we introduced UltraClear, our newest laser treatment. Today we're diving deeper into one of the most exciting features of this technology, laser coring. If you're curious about advanced skin rejuvenation, you're in the right place. We'll be covering what laser coring is, how it works, the unique results it delivers, and why it sets UltraClear apart from other treatments. We also have 2 exclusive promotions just for attendees, so make sure you stay tuned until the end of the webinar to hear all the details. Before we get started, let me introduce you to our wonderful speaker. I'm pleased to have introduced Dr. Sitapara, who is the founder of Prime Facial Plastics here in Columbia, Maryland, which he opened up in December of last year. He is double board certified facial plastic and reconstructive surgeon who specializes in deep plane facelifts and closed scarless rhinoplasty and hair transplantation. So without further ado, Dr. Sitapara, the floor is yours.
Thank you so much, Holly. Everyone, I'm super excited for you to join and learn about this amazing new technology. Since bringing this on in June and July of this year, we've been using it almost nonstop, and that's kind of unheard of for laser treatments. Summertime tends to be that time of year where people shy away because you maybe have to be out of the sun, or nobody really wants to be recovering while they're out in the beach. But this laser has really been a game changer. And I'm really excited as we've been using the laser more and more and pairing it with some of our surgical treatments, some of our non-surgical treatments. We're seeing some really tremendous results, and I'm very excited to dive into the why. If we have some of our patients that are on the call, they may know that I love educating my patients on why we're choosing a certain treatment and how it works. And partially it's because I'm a big nerd and I like the science behind things. But I think when people understand how the aging process happens and why we're choosing one modality over another, or why this is so different, which this is really a kind of groundbreaking new type of technology in the laser field. I think people get it just as excited as me. So without further ado, let's dive into it. And we've got, like Holly mentioned, we've got a few bonus surprises and some things that I think you guys will really enjoy. So please watch till the end. All right. So let me show you this quick little video about this laser.
The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs, balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly, and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
Awesome.
Let's
pause this. There's some exciting things that are in that video that I think it touches on, and we'll dive a little bit deeper. But some of the main points and some of the things that excited me most about this new technology is, number one, that all skin types can do it. I can't tell you the number of people that have just shied away completely from lasers in general, other than maybe laser hair removal, just because they kind of have this thing ingrained, or this fear ingrained in them, that they their skin type, whether they're, we'll go through the different Fitzpatrick skin types, but whether they're kind of more olive skin tones or deeper brown shades like me, that those types of lasers really can't be used on those skin types. So I think the fact that this has ultimate safety is one of the biggest draws to it. The other thing is kind of the customization that you can really do with this laser. Whether you're somebody in their 50s and 60s looking more for like reversal of sun damage and wrinkle reduction and a little bit of skin tightening, we can customize it to that. Or if it's somebody in their 30s who's dealt with acne scars and hyperpigmentation, you can customize it to that. So really depending on kind of what you're looking for and what your goals are, we can really kind of fine tune the laser and really make it work for us. And this was one of the surprises, is that we're going to actually do a live demo during the Q&A. Our wonderful patient care coordinator, Jen, she's going to get treated by our wonderful nurse, Veronica, tonight. And so you guys can see how the laser works firsthand. And we'll do that during the Q&A so I can answer questions while you guys are seeing it live. And so one of the big questions that people ask is, am I a candidate for UltraClear laser? And really anybody is a candidate for it, and anybody can notice a significant improvement in the quality of their skin from these treatments. And so it can treat uneven skin tone and texture. If you're younger and you're just looking for some textural improvement, it can help with fine lines, particularly around the eyes. I love it. Acne and surgical scars. These are areas where there's not really a lot of laser treatments and things out there that can really improve and diminish these lines. If you've suffered from acne scars, there are so many people that have tried everything under the sun with really, really poor results. I had one patient who had done 10 microneedling treatments with really minimal efficacy. And even with one UltraClear treatment, we're already noticing significant improvement in the acne scars, even when you're comparing it to the 10 microneedling treatments that she had already gone through. Pigmentation has been huge. I don't know about you guys, but if you look at my skin funny, like it tends to hyperpigment. And so anytime I get a little pimple or a little breakout, my skin will end up laying down more melanin and be hyperpigmented. And so this gives us a way for us to safely wipe that away without significant downtime or risk of burns or anything like that. And then as we'll get into overall skin rejuvenation and even some skin tightening with the laser coring technology, which we'll get into a little bit later. I think one of the main reasons why I chose UltraClear also is I'm a big baby when it comes to any sort of non-surgical treatment. When I get Botox, I need my nurses holding my hands as they're doing the treatment, just because I, like many men, don't really like a lot of discomfort. And so during our last webinar, I actually did a live treatment with the UltraClear, the 3D Miracle treatment, on myself with no numbing cream or anything, and it literally feels like a 1 or 2 out of 10 as far as any discomfort. I'm sure anybody who has a higher pain tolerance than me, which is most people, they probably would say that it's about a 0 out of 10. You feel like it's a very light sunburn afterwards for about an hour or two, and then literally 0 pain. The fact that you can treat so many different skin concerns is huge. The fact that you can come in for these 3D Miracle treatments, which is the lighter resurfacing mode. You can really come in, get your treatment done during lunchtime, go back to work, and everyone will be just fine. And then you can treat multiple areas. We're starting obviously we treat the face and neck primarily here at Prime Facial Plastic Surgery, but we've been starting to treat body scars, some laxity on the arms and other areas too. And so we're just starting to scratch the surface on what this technology really can do. So this is what I was talking about, the different skin types. So there's different Fitzpatrick skin types, we call them. Basically, as you go to like the type 4, type 5, type 6, Really, those lasers traditionally, like CO2 lasers, which is tried and true resurfacing lasers, really types 4 and above couldn't do them, just because it would create this tremendous amount of heat in the tissues. And like we were talking about with my hyperpigmentation, as soon as you introduce that heat into the skin, you like really stimulate those cells that produce the melanin or the dark spots, and just you would get tremendous hyperpigmentation. And so what this technology has is it's cold ablation. And so what that means is it generates zero heat. I can literally set it so that the amount of heat delivered is zero, which is completely unique to this laser. And so you can get the same types of results as a CO2 without the risk of hyperpigmentation or even hypopigmentation, where you actually completely remove the pigmented cells. And so this is partly what I was talking about with the different levels of the treatment. You can do really nice superficial skincare treatments. Everybody's looking for that Korean skin glow that people are talking about. And if you do some 3D miracle treatments, that's the really minimal social downtime. Everybody can do these treatments, and you can address pigmentation, sun damage, texture, tone, fine lines, with really minimal downtime. And then for people that are looking for more dramatic results, we can of course turn up the settings in order to go a little bit deeper into the skin, really stimulate that collagen production. And then at the most advanced level, we can do laser coring, which we'll dive into. And that actually will remove little microchannels of skin, because of the inflationary effect that the aging process has on our jaw lines and our necks. And that gives us a really nice skin tightening effect. And so there's 3 levels of the treatment. The 3D Miracle, that lightest treatment, is going to just address that top layer of skin, going into kind of the epidermis, or that top layer of our skin. As we go deeper into kind of the more aggressive treatments, we're getting into that dermis, which really stimulates where that collagen production really happens, that skin tightening. And then we can go even deeper to really address skin laxity with that laser coring. Like I mentioned, the tried and true laser was the CO2 laser. It came out in the early 90s. People were doing it primarily on people that have the lightest skin tones. People would have tremendous downtime, meaning their face is really swollen. They kind of look like a burn victim for several weeks. Even after about 4 or 5 weeks, people are just now or just then getting out back into normal daily life, because they're just looked like they had the worst sunburn of their life. And so technology didn't really change for a while, until about 2021. There were other lasers that came out there like erbium and things like that, but they weren't truly cold ablative. And so it delivered similar results as the CO2, but still all skin types couldn't really take advantage of it. And it still had considerable downtime. And so what makes UltraClear really different is when it launched in April 22, it got FDA approval for treating all skin types. It's being cleared for more and more things. We're using it for fine lines, wrinkles, age spots, skin resurfacing, and then we're also diving into, and I believe FDA clearance will be coming probably within the next year or 2 for redness, rosacea. I'm using it a lot with my facelifts to improve kind of any redness on any scars or anything like that, to really kind of make the results so much better. And one of the reasons why this has less downtime and less discomfort really is that lack of heat. But let me show you this video because it'll help explain it a little bit better. So essentially we have that, this is showing at coagulation of 1, and really we can even set it to 0 if we want. And essentially it delivers these 4 pulses in each little level. These little channels are significantly smaller than any other laser out there. And so a traditional laser like an erbium or a CO2 laser would leave these massive channels into the skin, which leads to significant downtime. And so by delivering more of these little channels, we're just making them smaller. You can get a lot of improvement in the skin, but the surrounding skin gets an opportunity to heal from outside within. And then you can really try to set that coagulation. So there's certain skin types where we want to get that coagulation effect, and we can want to get that little bit of tightening. And we can really fine tune it depending on your skin type and what your goals are, and even the area of the face where you want to get that treatment. All right, let me show you what somebody's experience was like. You guys will see live kind of what a 3D miracle treatment will look like, but here you can at least see kind of what this will be. And so we just place a little bit of eye protection over you. We have these settings that we can address, and then you'll start seeing the treatment. It's pretty quick. We can cover the whole face in about 15-20 minutes. No numbing creams needed for the 3D Miracle treatment. Can really improve the skin quality with next to zero downtime. And this is a patient experience.
I had my first treatment, absolutely no pain, no recovery time. I was a little reddish pink, maybe for a day. And that was it. And the results were great. And this time, 2 passes, absolutely no pain. And I can't wait to see what's next.
So, I mean, really the 3D Miracle, it's great to have real results that you're really ablating that top layer of dead skin, really getting that nice glow without that significant downtime. Now, I would say most people do have some pinkness to the skin for a day or two. I think she's probably a fast healer. You might see little tiny rings and little dots for maybe a few more days, but literally by a week, your skin looks completely back to normal. I did a moderately aggressive treatment and was seeing patients the next day. Nobody really noticed anything other than a fellow med spa owner. She came in for a consultation and she was like, "You did something," but really it's not a bad recovery or anything like that. Now, before we kind of dive into some of the before and afters, I did want to say that some of the feedback that we got from our last webinar was that people wanted to know which treatment was right for them. So we'll be offering free 10-minute virtual consultations. You guys can call or text our main number. That's 301-302-7272. Instead of people wondering like whether they're a candidate or not, or what will this address their concerns, and having to pay our traditional consultation fee, we thought this would be a nice way for people to just be like, "Hey, I learned about it. I joined the webinar. I just had a couple additional questions. Just wanted you to see my face." And so we're offering those. If you guys want to call our team, they're here on standby basically to block out our 10-minute intervals, and then we can get you on the books. And essentially, I'll send you a little text with a little video call, and you can hold up your phone, and we can do a quick little consult. So let's go over some pictures. So the superficial 3D Miracle treatment, this is the tried and true, very, very quick lunchtime laser. People can get in and out and have a laser treatment done without significant downtime. And so I'm going to run through a few pictures and kind of point out some of the improvements that people notice. So you're really getting rid of some of the brown spots, some of the skin damage and sun damage that happens over time. You're getting improvements in fine lines, particularly around her crow's feet. She actually has a combination of brown spots, but then also diffuse redness. And if you can notice that the overall kind of skin tone has changed, and this is only after one treatment. This is similar kind of case where you're treating those brown spots. If you want to take a peek at kind of this area right here where you're noticing that big brown spot, that's really, really faded again after one treatment, which is pretty exciting that you can get something out there that really is going to improve your skin quality even with 1 or 2 treatments. And this is that skin glow. So if you want to notice that people, just generally speaking, their skin just looks healthier, more vibrant, and really get that glow to them. And even in the darkest skin tones, you can do these treatments and get really, really nice results. On the neck as well, treating some hyperpigmentation, some of the fine lines that happen with us using our cell phones too much, and really that tech neck, you can really get some really nice improvements. And so if your only concern is the neck, we can always treat that. So I've been treating people's décolleté as well to kind of get rid of some of that sun damage and try to improve that skin quality over time too. With slightly more aggressive treatment, this is 5 days post one treatment. You can really improve some of the discoloration, the dyschromia across the face. You can get some dramatic improvements like this giant area of hyperpigmentation, and this is with 2 treatments. You can get some really nice fading of some of those hyperpigmented spots. And same thing here, this stubborn kind of melasma, because melasma tends to be triggered a lot by heat and by sun exposure. One of the concerns that a lot of people have is, will I make my melasma worse? And because we can use and set this to zero heat, we don't see that stimulation of those melanocytes, those pigment producing cells, and we get really nice improvement and clearance of that hyperpigmentation without that risk. Now, laser coring. I think this is a super interesting topic. And what I want you guys to think about is that just like the osteoporosis process takes place in our entire body, our facial skeleton actually gets smaller and shrinks as we age. So our mandible, our jawbone actually gets thinner or weaker. Our area of our nasolabial folds actually widens in that area and flattens out. And so our whole facial skeleton shrinks down. Meanwhile, with repeated motion and just the effect of gravity, you get an inflation, or the skin envelope essentially inflates. And so it's really, there's a discrepancy between kind of the volume that's supporting it underneath, or your skeleton, and the skin over top. And so there have been probably hundreds of lasers out there that have kind of promised this skin tightening effect. And anybody can say that, oh, it stimulates collagen. That's kind of like a little buzzword that seems to be more of a sales tactic than anything. But what I've been really searching for is something that is going to take care of that discrepancy. So without actually ablating and removing little microchannels of that inflated skin, you're not really going to get a noticeable skin tightening effect. You might get a little swelling into the skin that looks like skin tightening, but you're not really addressing the main root problem, which is that inflation that we're talking about. Now, it sounds a little scary to reduce these little microchannels, but what the UltraClear has done that no other laser has been able to do is, because each beam is so thin, it doesn't leave any scarring. And so this video will show a little bit of kind of how that works. So let's go over some photos. So this is actually one of my favorite patients. She came in for laser coring and 3D miracle treatment. And essentially we treated her full face and we treated her full neck to improve some of the hyperpigmentation she had, and some of the fine lines she had. If you want to look at her forehead in this area, seeing the improvement there. But the thing that I noticed the most, really, we use that laser coring because her jawline and the jowl area were bugging her more than anything. And now she's not quite ready to take the next step and do kind of a surgical type of reduction, but by doing that laser coring in this jawline, we can really get a nice skin tightening effect, not just improving the fine lines in that area, but really trying to get that nice jawline. And so what I like to do is actually treat the jowl itself and then kind of run it along up and down the jawline to really kind of get this nice skin tightening effect without looking pulled or like without a significant downtime. This is literally 1 month after her treatment. So we gave her a little bit of time for that collagen to really start building and tighten up in that area. But some other areas or some other people that I think you can see the improvements. This patient had a combined UltraClear treatment plus the laser coring in this jowl area. You can see the noticeable improvement of her overall skin tone, but then you also see that improvement in those jowls and some of that skin redundancy. You see that as it gathers in the marionette area and in the nasolabial folds. Another area where I absolutely love it is underneath the eyes. So some of the crepiness you can really address with the laser coring, really smoothing out that skin without any surgery. You can get some really nice improvements in the neck and the jawline with laser coring and UltraClear. Again, showing that improvement underneath the eyes and then the neck as well. Just you could see the improvement in the redundancy as this tissue is falling over itself, really trying to get that nice, healthy skin tightening. Same type of deal. This jawline was treated with laser coring, and you're getting not only an improvement with the hyperpigmented spots throughout her face, but you're simultaneously getting that skin tightening effect along the jawline, which is where it bothers people the most. Even with severe sun damage, really kind of deep, coarse wrinkles, you can use that laser coring to really try to help that. You can even get some skin tightening in the neck where there's folding of that skin forward, and this showing kind of a realistic expectation of getting that kind of tissue that's overhanging to really start to tighten up. And same thing around the mouth. Even long-standing sun damage, you can really try to improve those areas by doing that laser coring, because we're really removing those little microchannels of skin. And so what I wanted to do, I'm super excited about this laser. I wanted to give my patients a chance to actually use it and try it and learn for themselves. I personally love it. I had to fight Jen, who is about to do her live treatment, to see which one of us was going to get the treatment today with Veronica. But really, I wanted to. I'm all about proving it, and I think with some of these promotions that we have going on for our webinar attendees, I think people can kind of see for themselves and see that they really would benefit from this. And so, Holly, I guess I leave it to you.
Yeah, absolutely. So guys, right now we're running a few promos. You can do a BOGO 3D Miracle. I feel like everybody knows what BOGO means, but it's one of my favorite words. Buy one, get one. So you'll get buy your first session, you get the session free. So that's going to be an $800 value. And we're also offering a free laser coring session if you purchase a 3D Miracle package. So this is going to help you tighten up the jowls and jowline while also refreshing your entire face. So both of these promos are only available through the end of September. So definitely call or text us to get on the books here sooner than later. Hopefully everybody's excited to get a free 10-minute consultation after this as well. So you can also kind of move forward and book from there as well. Our team is ready and by the phones. Let's see. And then I think we can go ahead and get into the Q&A here.
Oh, actually, really quick, Holly, do you mind going back to, or let me go back to.
Yes, go back. We want to do the $1,000 off the Korean package again. Awesome.
So last time we had a promotion, and we had offered it only to 5 participants, but I think we're loving the results so much that we just wanted to offer it as an extension to anybody joining the webinar. But it's $1,000 off our Korean Glow package, and I'm going to go over just really quickly about what that is. but it includes an IV NAD Niagen treatment, which is like the latest and greatest anti-aging from within treatment. You get a professional grade LED red light treatment. We do a moderate to aggressive UltraClear resurfacing everywhere on the face, and then we use a growth factor on top to enhance your result and help you heal as fast as possible.
Awesome. I love that we're throwing that one in there. That's another surprise. Okay, so do we want to go into Q&A now? We have a couple questions in the chat box. Okay, perfect.
That sounds great. In the meantime, I'm gonna bring Jen in, and then Veronica, our nurse, is going to get set up, and we'll do the live treatment.
Awesome, perfect. So the first question, Dr. Sitapara, is can the treatment be adjusted to be at different depths in different facial areas in the same treatment?
Yes, yes. So literally this afternoon, we were addressing somebody that had deep wrinkling, and we wanted to essentially treat the deepest layer first. And so we used some of the ultra mode, basically, where we can really stimulate that deep collagen. And then we did more superficial treatments for the areas that just have some hyperpigmentation. And so we can pick and choose. We don't need to do like a cookie cutter. Okay, these are our settings. We're going to treat the whole face exactly the same way. For me personally, when I get my UltraClear treatments, I'll have Veronica, our nurse, treat my hyperpigmented spots alone in like a very dense way, and then do an overall kind of lighter treatment everywhere. So we can kind of customize it just to whatever you need.
Fantastic. Let's see, another one just came in. What about pore size? Are those made smaller on mature skin?
Yes, absolutely. One of the combinations that I really love is using topical Botox, actually. So essentially you want to think about, we're using the laser to create little microchannels into the skin. And then if you put Botox on top of it, it causes those pores to really shrink down, really gives a really nice glow to your skin. And so if pore size is like your number one concern, that these pores here or the ones on your nose are really driving you crazy, then that would be my go-to for sure.
Okay, we have another really good question that just came in. For aggressive treatment, what type of local anesthetic is used?
Got it. So I'm all about that pain, like minimizing that to next to zero. So I have a specialty pharmacy actually that will makes a very specially compounded, really, really strong topical anesthetic. It's lidocaine, benzocaine. It's a whole bunch of different topical numbing agents, and we put that on. We let that sit for about 30 to 45 minutes. Once that's really soaked into the skin, we also have Pronox, which is a light laughing gas available. It kind of feels like a martini and a half. Hopefully some of the participants have started happy hour already. And essentially it just kind of relaxes you, makes you not care about any discomfort or any minor pain that you have. And the beauty of it is that it's in and out of your system in 5 minutes. And so you can drive yourself, you can still drive yourself home. You're not going to be pulled over or anything like that. And you're going to feel just fine. And it's completely controlled by you. So it definitely is available to people that want it.
Awesome. Another question. We got the Q&A box is it's very active right now, which is great. Let's see. What about those pesky smoker lines around the lips?
Yes, those drive people crazy. We as an industry have tried to do like filler in that area, and that can work somewhat well, but if you keep trying to do those treatments, you really end up with a lot of fullness around there that really wasn't there to begin with. And so the UltraClear laser, especially the laser coring mode, I've been loving it around the mouth. And in order to really try to resurface that skin and make it look a lot better.
Fantastic. Okay, one more and then let's go into the live demo. So last one for now is, you mentioned that this is good for acne scars, but what about larger scars like from surgery or accidents?
Well, actually, another patient that we just treated today, this patient unfortunately had really, really large, severe scars. I'm talking like $50 size on each cheek from an attempt by another surgeon to actually surgically excise acne scars. And so they left a ton of scarring in both those areas. And we've been using this laser to really try to rebuild new skin, essentially ablating and using that laser coring and some of the deeper ultra modes to really try to resurface that skin and get it to look a lot better. And I think for him, it's going to be really great. For post scarring, I think it's wonderful that we can offer something that from tummy tuck scars to body plastic surgery and even just regular body surgeries of any kind, we can get that scar remodeling to happen even years down the line. Traditionally, people would think about that, oh, you have to catch this scar treatment or catch this scar at this sweet spot of like 6 months after it. And if you didn't really treat it within that time period, you're not going to get any benefit. And so we're seeing scars that are even 20 years old get improvement from trying to treat it because we're basically getting new skin to heal in place of that scar tissue.
Fantastic. Awesome. Are we ready for the live demo?
All right, we got 2 questions actually from Instagram Live.
Oh, fantastic.
How big of an area can you address in one session?
How big of an area can we address in one session? So we can treat the full face, the full neck, all in one treatment. After that, like if somebody really is bothered by the chest as well, like I would try to separate those two treatments, just because the really strong topical anesthetic, there is kind of like a dose that we can't go threshold that we don't want to, and a safety that we don't want to kind of compromise. So we'd probably separate those, but we can treat, I mean, that's a pretty large area. I mean, if somebody wanted their arms treated for whatever reason, we can try to address some of the skin laxity there and do both arms, I guess, and treat a large area on the abdomen, all safely.
Next question 2 is it possible for someone with prior history of post-inflammatory hyperpigmentation possible melasma?
Yes, this treatment's great for post-inflammatory hyperpigmentation. That's actually my personal number one skincare concern is PIH, or the little dark marks that happen after a treatment. And so you can absolutely treat this with that, because we set that heat to 0 in those cases. And then you can also treat melasma with it, although we would treat kind of like a little bit more carefully, because we obviously don't ever want to make it worse. But you can set that coagulation to 0, that heat index, and really safely get that resurfacing of that skin without that added risk of worsening your melasma.
Good job.
Great questions. Great questions. Awesome. Well, if that's it for the Q&A, then I'm going to have you guys see kind of what the treatment looks like with Veronica and Jen here. So Jen's our wonderful patient care coordinator, if you guys haven't gotten the chance to meet her. We're going to get started with a little treatment, and I'm going to try to walk you through kind of what's going on and what Veronica has chosen to do for her settings. All right, let's see if I can bring it up close here as she gets started. How's that feel, Jen?
Fine,
Not too bad?
not bad at all. It's a little warm, not hot, just warm, almost relaxing. Small vibration.
And essentially, this is just getting rid of that top layer of dead skin, going into that little bit deeper to try to stimulate that collagen production and really get it looking the best it possibly can. And what Veronica's doing, so she set it at about 20 microns. So the top layer of our skin is about 100 microns. And so we're really trying to customize it to help with some of those fine lines that happen on the forehead. Even people that do Botox regularly, you get some of those lines that are just stubborn, either in between your eyebrows or on the forehead. And this really helps with those static lines that can form there. While Veronica continues that, I'm gonna hop over here and just talk about aftercare real quick. So after the 3D Miracle treatment, I mean, there's really minimal downtime and really kind of minimal things you need to do. Afterwards, you just want to use a gentle cleanser, gentle moisturizer, nothing like with a retinol or an acid in it. And you can get some really nice kind of improvements in the skin. If you're doing like a deeper treatment, like laser coring along the jowls and jawline, which is our special tonight, you can use like a vinegar solution. We kind of go over how to make this. This is just some distilled water with a teaspoon of vinegar. That really kind of avoids any skin irritation in that area for a few days. And you use a little bit more of a heavier kind of Aquaphor or Vaseline over those areas so that skin gets its best opportunity to heal super, super quick. Even with those deeper laser coring treatments, you're looking at about 7 to 10 days of downtime in that area.
Fantastic. Awesome. Let's see. We do have, I like to always ask this one other question. What's next? If somebody wants to book, obviously we know if you're ready to do your 10-minute consultation, please call or text that number in the chat. It's also right on our website that I can pop in the chat for you as well. And these promotions are only available until the end of September. So definitely get your consultation in and get booked for your treatment. We can't wait to see you.
Yep. Excited.
Perfect. And I'll pop the website in the chat here as well. So we hope to hear from you guys soon. Thank you, Dr. Sitapara. Thank you, everybody, for attending. Thank you for the live demo. That's absolutely fantastic. I can't wait to see her results afterwards.
For sure. We'll be sharing them on our socials. Thank you so much, Holly, and thank you, everybody, for joining.
Bye.